Hi, I'm here to talk to you about Medicare today. And this is if you are brand new to Medicare or can even barely spell Medicare, not even quite sure what it is or how to get it. This will explain from soup to nuts and everything for you. I want to start off though with an apology. Not from me, I'm pretty awesome. But on behalf of my industry, my mom aged into Medicare a few years ago. And between text messages and phone calls and Facebook and news advertisements and radio, and I'm pretty sure somebody jumped out of the bushes one time and told her to get a Medicare Advantage plan. It is just information overload. It is so overwhelming. And on behalf of my industry, I sincerely apologize. I'm going to share my screen here and we can get right into it. So first off, my name is Tim Gustafson. I've been a Medicare broker since 2005. I focus on the four main staples of retirement for retirees, which is your Medicare, life insurance, long-term care options, making sure your money doesn't go away, put you in those programs where you participate in the gains, but never ever the losses. And I'm looking forward to talking about Medicare today. I've got an absolutely beautiful wife that I adore, two awesome kids, and two of the world's most okayest dogs. I mean, one I think has Tourette's and she barks at anything within a 6 mile radius, but we love her anyway. I'm going to give you two quotes that I kind of try to keep in mind every day as I operate and do business, just so you know who you're dealing with. One is those who have good intentions make promises, those who have good character keep them. And I try to do everything I can to say what I do and do what I say. And another one, I'm far from perfect on this one, but live your life so that those that know you but don't know Christ want to know Christ simply because they know you. So who is Medicare for? Medicare is for any United States citizen or legal resident that has acquired the age of at least 65 years or older. You can qualify if you're younger than 65, if you have qualified for Social Security disability and been on that for about 24 months. And then any age and with the diagnosis of end-stage renal disease, which is kidney failure, or Lou Gehrig's disease, you get to go straight to Medicare and you do not have to wait for that 24-month period. So a question I get a lot is, do I even need to sign up for Medicare? And if you're still working or your spouse is still working and you have coverage that is as good or better through your employer, and there's at least 20 employees, that is a key thing there too. If you work for a very small company with 15 employees, does not matter how good the coverage is, you will be penalized if you try to sign up later. You can always, if you do that, just sign up whenever you do set to retire. And there's an extra step where you have to fill out a paper application and then also fill out a credible coverage form, which is on my website. And I can help you walk through that process if you're in that stage. If you have military benefits, one, thank you so much for your service. God bless you. Two, the VA is considered credible coverage for the Part D as in drug, but not the Part B as in boy, the medical portion. I would highly, highly, highly recommend that you get Medicare Part B if you have the VA benefits. If you have TRICARE, then yes, you must get Medicare to get TRICARE for life, and you must have Medicare Part A and Part B. We have some absolutely wonderful programs that work with TRICARE very seamlessly that can give you extra benefits and even save on your Medicare Part B premium. Love to talk to you about that. Please don't forget to schedule some time with me. The other one is I get people that are so healthy, I just don't want to pay for it. I'll sign up and get it later on. And if that's the case, then you can face some pretty hefty penalties. And I would not recommend doing that either. Again, please schedule some time with me, and I can talk to you about some plans that may be able to offset those Medicare Part B costs that I'm going to get into here. So the first step is to sign up for Medicare Part A and B. If you are drawing Social Security and you are not, aging in at 65, there's absolutely no action required whatsoever. It gets done for you automatically. If you are not drawing Social Security, you're going to wait till your full retirement age is 66 in a couple months or 67, then yes, there is action required. You do need to go to socialsecurity.gov. You need to call Medicare. You need to go to local Social Security office or use that paper application that's on my website. I would highly recommend starting that process about 3 months before. It can take 60 plus days sometimes to get through the Medicare system. It can also take 14, depends on the time of year and whose desk it ends up on. Once you get your Medicare A and B, then you have one of two options to decide. You can go with a Medicare supplement, which Medicare remains a primary, and then you pay an additional premium for a supplement, which picks up some of those other co-payments and everything like that. You have to get a separate prescription drug plan, and you pretty much have to pay some extra premium and have all costs covered for you. Or you can go with a Medicare Advantage plan. Medicare Advantage plan, you sign up with a private company that takes over as primary. Medicare A and B kind of subsidize and pays them to take over. And then you just have to pay co-pays as you use it, but there's typically no additional premium. Medicare Part A, what is it and what does it cover? So it is $0 per month if you or your spouse worked for at least 40 quarters or 10 years. Most people qualify for that. If you do not qualify, then you can still get Medicare Part A. It's just a pretty hefty premium, which is listed there. But what does it cover? So it covers you in the hospital, covers the facility cost, covers the hospital bed, any food that they feed you, and the nurses saying hi to you. There's a $1,600 deductible, and that is if you were inpatient, and it doesn't matter if that's for 1 day, all the way up to 60 days, it's the same $1,600 deductible. If you are still in the hospital after 60 days in one continuous hospital stay, or you go home and get back in within 3 days of being released of that hospital stay and keep doing that until you've been in there for more than 60 days, then there is a $400 per diem for day 61 through 90. And then it jumps up to $800 per day if you're still in the hospital after day 90. These are very rare cases. And then the other thing that Medicare Part A covers is the skilled nursing facility. So typically you're only in the hospital for 1, maybe 2 days, and then they ship you over to a skilled nursing facility or rehab hospital, where it would be 0 for days 1 through 20, and then $200 per day for days 21 through 100. Do want to clarify though, you do have to be in the hospital for 3 consecutive days prior to that skilled nursing being covered if you just have original Medicare A and B. The Advantage plans, there are no 3-day hospital stay requirement. Medicare Part B is all things medical. This is all doctor, specialist, cast, splints, x-ray, surgery, ambulance, MRIs, lab work, blood work, occupational therapy, physical therapy, mental health, durable medical equipment, ambulatory surgical centers, and all of those type of things. I'm sure I'm forgetting a thing or two, but I imagine you get my point. And with that, the standard premium is $164.90, and then it's an 80-20 plan. Medicare covers 80, you cover 20. Now, Medicare does not pay 80% of what the doctor bills. Medicare pays 80% of what Medicare approves. So if you go to the doctor bills Medicare $1,000, Medicare does not jump over to that table and go, ooh, here's $800. Please take it. Here you go. Medicare gets that $1,000 bill and they go, oh, that's adorable. We approve 400. And most doctors just write off that $600 difference. That $1,000 bill magically becomes a $400 bill. Medicare then pays 80% after the deductible, so $320 in this make-believe example, and then you would have to pay $80 in this make-believe example. If the standard premium, as I've referred to, is $164.90, if you have a lower income of maybe $24,000 a year or less, you may be able to qualify for a program to help lower that. However, if you're blessed with a much higher income, $97,000 or greater for an individual, $194,000 or greater for a couple, then there will be a surcharge. But most people fall in that awesome category where you're too rich to be poor and too poor to be rich. That income is based off of your income 2 years ago, so it would be your 2021 income. If you do can show that this was a one-time distribution of an IRA or something was off with your income being that higher, then they might be able to waive the IRMA, but that'd be between you and Social Security. Medicare Part D, as in drug, is just that. It's your prescription drug coverage. I'm going to go over the Medicare Part C plans and the advantages a little bit later. But with this, they break down the drugs into 5 different tiers. So you have your tier 1, which is your preferred generic, your tier 2, your non-preferred generic, tier 3, your brand name, tier 4, your non-preferred brand name, And tier 5, your specialty drugs. There is no one plan that's actually underwritten or offered by Medicare itself. These are all done through private companies and all follow that kind of standard. And with that, they offer stage 1 would be your deductible. Standard deductible is 505. There are some plans that have no deductible, but that is the standard deductible. After that, you get into the initial coverage period where you would just pay the copay assigned for the drugs that fall in those different tiers. So if it's a tier 1, typically $0 to $5 copay. Tier 2 is usually $0 to $10. Tier 3 is usually a $47 copay. Tier 5 is usually about a $97, $95 copay. And then tier 4 is usually 33%. And you would just pay that copay until the actual drug cost, so between what you and the insurance company paid together, reaches 4,660. After you hit that stage, then you fall into what's called the coverage gap or the donut hole. This used to be a lot bigger and a lot scarier. You used to have to pay 100% of the drug cost while you're in this category, but the government forces the manufacturers to offer a 70% discount. The government also kicks in a 5%, and leaving 25% of the drug cost for you to pay while you're in this category until you have spent $7,400 out of pocket, and then you fall into the catastrophic stage, which you're about 95% covered. And in the beginning of the year, it starts all over again. Again, if you join Medicare Part D, there's many different options, and I'd love to spend some time with you. Please schedule some time on my calendar, and I'd love to look at your drugs to find out which plan is going to give you the most amount of benefits for the least amount of money. Average cost is $43.71. However, if you do have that greater income, then there is that IRMA or the income related adjustment amount as listed there below. So just to summarize everything, so your Medicare Part A is your hospital benefit, covers you in the hospital for days 1 through 60. Then there's a per diem, pretty hefty deductible at $1,600. Again, zero premium. Medicare Part B is all things medical, doctors, specialists, CAT splints, x-ray surgeries, ambulance MRIs. With this, there's a very reasonable deductible, $226 deductible. And then it's an 80-20 plan. Medicare covers 80, you have to cover 20. Standard premium $164.90. Medicare Part C are those advantage plans. And how these came about or that these private companies said, went to the government and said, okay, if people just have Medicare A and B, they have no clue what they're going to pay for any services rendered. For example, if you had to get an MRI, you have to pay a $226 deductible and then 80% or 20% of the Medicare approved amount. Well, 20% what? What is the Medicare approved amount? You would never know prior to. So what these private companies did is they went to the government and said, hey, we got a great idea. Why don't you have Medicare A and B pay us to take over as primary? So forget about the high deductible, forget about the 20%, and we'll have our clients sign a contract with us, and it tells you exactly what your copay would be for every services rendered. So zero for a primary care doctor, for an example, $20 to $40 for a specialist, 50 to $150 for an MRI, numbers like that. And you would know exactly to the penny what you would have to pay prior to getting any services rendered should you need those. And then your prescription drug plan, or Part D, is just that, covers your prescription drugs. Just went over that. So to kind of compare the two, this is kind of my cheat sheet. Now, regardless if you go with the Advantage plan or the supplement, you have to continue to pay your Medicare Part B premium. But with an Advantage plan, there's typically a very low additional premium, or there's even now plans that would actually offset that Medicare Part B premium and pay a portion of it for you. So for example, if it has a $25 a month buyback, your plan would pay $25, you would only have to pay $140. Or if it has a $100 buyback, you would have to pay $65, and this would pay the $100 for you. And then you just pay the copays that are assigned with the services that you get rendered. With this, there would be a network of doctors. Now, if you stick with the big three, United Healthcare, Aetna, Humana, we're talking 600,000 doctors nationwide plus that you'd be able to use. And then all of these plans have a max out of pocket. So if something catastrophic happened where you say you racked up $20 million worth of medical bills, if you just have Medicare A and B, There's no limit to the 80% that Medicare would pay, and there's also no limit to the 20% you would have to pay. So that could equal hundreds of thousands of dollars out of pocket. But with these Advantage plans, there's no limit to how much the private company has to pay or the Advantage plan company has to pay for you, but there is a limit to how much you would have to pay. And that can be anywhere from $1,000 all the way up to, $7,000 or so, depending on the plan. This usually includes your prescription drugs. Doesn't have to. So if you have VA or you don't have that coverage, we can find you plans that don't have it. And these are the ones that have all of those extras. So the dental and the vision and the gym memberships and the over-the-counter items and the hearing aids and all of those type of items that you hear nonstop advertisements for. So your estimated drug cost, if you choose this, is you have your Medicare Part B premium, then you have your Advantage premium, if there is any, and then just whatever copays you end up paying for the year. And with a supplement there, this is where you do pay an additional premium. That can, if you're 65, that can range anywhere from 100 to 150, depending on the state that you're in, and male, female, smoker, non-smoker, that kind of stuff. But there's no copays whatsoever. So you pay a monthly premium and no copays. There's also no network. So if you lived in Denver and you wanted to go to the heebie-jeebie specialist, and the best heebie-jeebie specialist was in Dallas, and I use the heebie-jeebies because it's made up and I don't wish anything on anybody, but you can just fly to Dallas and knock on his door and use them. I mean, I'd recommend an appointment first, but there's no restrictions whatsoever. And the max out of pocket, and the plan that I generally recommend for people is the Plan G. Or if you live in a state that has those standardized plans, or if you live in a state that doesn't have a standardized plan, the Plan G equivalent. This is the most comprehensive. It picks up the excess charges. So if you go to like the Mayo Clinic or the Cleveland Clinic or one of these really high-end hospitals that does not accept Medicare assignment, those situations are a little bit different because when the doctor bills $1,000, Medicare goes, oh, that's adorable. We approve 400. If you go to a doctor that doesn't accept Medicare assignment, they can charge 15% above and beyond the Medicare approved amount, which in this make-believe an example would be an additional $60, 15% of 400. This also does not have a prescription drug plan included, so you do have to get a separate one. There's a little bit of an additional premium for that. And there's typically no extras. We might be able to get you on a plan that covers a gym membership that may or may not be available in your area. But your estimated cost would be your Medicare Part B as in boy premium, your Medicare supplement premium, plus your prescription drug premium. So I get asked all the time, Tim, well, what plan's best? And the answer is there is no wrong answer. As long as you understand your coverage and you understand the rewards and risks of it and you're satisfied with it, then you're on the right plan for you. I'd love to help you, enroll in a plan and find a plan that will work. Please schedule some time with me on my calendar, and love to get to know you a little bit better, get to know your retirement dreams and goals a little bit better, a little bit about your health history, and then we'll see what plan we can get you on that's going to give you the most amount of benefits for the least amount of money out of your pocket. Thank you so much for your time and attention. I know there's plenty of other things you wanted to do other than listen about Medicare, but thank you very much, and God bless.